Hello, my name is Yasmin Rahman, and today I'm going to talk to you about why it's extremely important to visit the dentist twice a year. As most of you know, I'm a dental hygienist and I work in the dental profession, so I see a lot of different types of patients. A lot of them will come in and say, "Oh my gosh, I hate coming to the dentist. I'm really scared," things like that. We understand where you're coming from. We're not there to judge you. We just want to help you. The dentist isn't just going to clean your teeth or fill your teeth. He's also taking care of your body and your overall health and can even save your life. So one of the most important reasons you want to go see a dentist is to prevent oral cancer. When you go to see the dentist, they will do an oral cancer screening for you. That's just general basic, comes along with your exam. You don't really know if you were going to have oral cancer, just like you wouldn't know if you had lung cancer until you go see a doctor. Doctor has to diagnose it for you. So if you're missing out on your appointments every 6 months, or you haven't gone to a dentist in 5+ years, imagine in those 5 years that you can develop oral cancer, especially if you're a smoker. Doesn't necessarily mean that you have to be a smoker to develop oral cancer. There are many different things that will cause it. So unless you're going to go see a dentist who's going to tell you you have oral cancer, you're really not going to know. I mean, how many of us actually sit in the mirror every day and look inside our mouths? I'm pretty sure most of you don't. And even if you were to, do you really know what you're looking for? I mean, do you know what's supposed to look normal, what's not supposed to look normal? I'm sure you have a general idea of what it should and shouldn't look like, but at the same time, when it's so small, you may not even be paying attention to it. There's many times I've come along a patient, tell them, "Have you noticed that bump on the side of your tongue? Have you noticed anything different? Is this burning you?" And they'd say, "No, I didn't know anything was in my mouth." That's why it's really important to go see your dentist, because he or she can catch those little things that you may not have caught. They will let you know if it's something that's an emergency or something that you should go get biopsied, or if you should worry about it or not, or if we should just watch it for every 6 months that you come along. But unless you go see your dentist, you really don't know. So that's why it's one of the really important reasons to go see the dentist. I'm going to show you some pictures of oral cancer, how it can start off small and it can grow into bigger things. So these are some photos of oral cancer. The one that we're looking at right now is leukoplakia, which you can see starting at the back of the tongue, so you really can't see. It's just a white foamy coating. This picture is of cancer that starts on the floor of the mouth underneath the tongue, where I'm sure none of us look every day. The next photo that we're going to take a look at is on the side of the tongue, and you can see the redness of it. Some people might think they burnt themselves eating something and it'll go away, but it doesn't. And it will turn into something bigger like this one here, which is a severe form of oral cancer. And by the time it gets to this is when people usually go to the dentist, which is it's too late by this time. One of the ways you can check for oral cancer is by using the Velscope light, which is what is shown in the picture. And what it does is it uses different fluorescences of the light to show the depths of the tissue. That way we will be able to tell what is abnormal and what's normal. Now I'm going to show you a video of a dentist who's going to perform an oral cancer screening without using the light and then with using the light.
Most dentists who regularly screen patients for oral cancer rely on visual and tactile examination. Dentists observe the face, head, and neck. The oral cavity is thoroughly examined, including the gums, tongue, floor of the mouth, and throat, which are prime sites for oral cancer. Dentists also feel for any abnormal enlargements in the face, lymph nodes, or salivary glands. This traditional method of oral cancer screening is not always accurate. Using highly concentrated white light, the dentist performs a conventional oral tissue exam. The instrument is then switched to violet light for a second look. The filtered glasses block the violet excitation light, allowing observation of the tissue's natural fluorescence. When suspicious tissue is identified, the dentist switches to amber-green light, which enhances the reflectance properties of normal tissue. This allows the dentist to observe the difference of vasculature between normal and abnormal tissue. Dentists are our front line against oral cancer. This new multispectral technology serves as a valuable additional tool for the early detection of oral cancer.
Oral cancer kills one person every hour of every day. Early detection of oral cancer can increase survival rates of up to 80% and higher, which is one of the many reasons why I want to go see the dentist. Another reason why you want to go see the dentist every year is to prevent from other diseases other than oral cancer, gingivitis, periodontal disease, cavities. Yes, cavities are considered a disease. So those are one of the other reasons why you still want to go see a dentist twice a year. So there are two forms of gum disease. Gingivitis is the first and periodontal disease is the second. The difference between the two is that gingivitis is reversible and periodontal disease is not, which is why you want to go see your dentist, so he can catch it for you at the early stages where it's reversible before it turns into periodontal disease, which you will carry on forever. Gingivitis is just when your gums are inflamed with plaque and bacteria, which causes them to become swollen, red, and infected pretty much. And that's because that bacteria is sitting underneath the gums, it's irritating the gums, kind of something similar to what I talked about in my demonstration video without props. Gingivitis can easily be transformed into periodontal disease within a matter of only a few weeks. So, for example, I would have a patient who would come in one day, get their cleaning done, and are supposed to come every 6 months, skip maybe, let's say, their next 6 month appointment and come a year later, and then I have to let them know that they've developed periodontal disease because within a matter of a few weeks, that bacteria sits underneath the bone and underneath the gums, and then it starts to eat your bone cells away, which is why you want to make sure you're going to your dentist, getting them cleaned every 6 months, because that way the hygienist or the dentist will take their instruments, get that bacteria out from underneath the gum to prevent it from eating your bone cells away. Here's a picture of a mouth that's healthy on the left side and one that's infected with gum disease on the right. And in your picture over here, we can see how the bone is high. On the left side, the gum is more pink, and on the right side, you can see the gum has come down, the bone has reduced, and you can see the plaque and tartar buildup forming on the crowns and the roots of the teeth. This picture shows the gum tissue forming into the different stages of the disease. The first picture, you can see the gums are pink and healthy, and then it goes into the gingivitis stage where you can kind of see a little bit of swelling in the gums, a little bit of irritation. Then you go from gingivitis, like I said, to periodontal disease, where in this picture you can see how the gum has dropped, the bone is dying, so the gum recedes with the bone, and you can see that plaque buildup in between the teeth. In this picture, you can see that the teeth look more elongated, and that's because there's more gum recession, the gum disease has further progressed, and at this point, teeth start to fall out, and people start losing teeth due to gum disease.
The main cause of gingivitis is the accumulation of plaque, the sticky film of food and bacteria that forms constantly on your teeth. The bacteria and plaque invade the space between the teeth and gums and begin producing toxins. These toxins irritate and inflame the gums, causing them to swell and bleed. Gingivitis is easily reversed, but if it's not caught in time, it can lead to a more serious infection of the teeth, gums, and jawbone that can lead to tooth loss.
So on average, getting your cleaning done twice a year may cost about $60 to $90 every time. And if you're not going to get your teeth cleaned every 6 months, let's say you're skipping a few years, 3 years in line, and they tell you develop periodontal disease, getting a deep cleaning is not cheap. It's almost about anywhere from $800 to $1,000 for just a general basic deep cleaning procedure. So in my opinion, I would rather go to the dentist once every 6 months, pay the $60 to $90 as opposed to having to come back after 3 years and then someone telling me I have to pay over $800 for a deep cleaning. Now, I'm not saying that if you go to your dentist every 6 months or at least once a year, you should be going at least twice a year, but even if you're going at least once a year or twice a year, that doesn't mean that you won't develop gum disease or cavities, but those are just ways we're trying to prevent them from progressing and becoming a bigger issue. So one of the next ones I want to talk to you about is cavities. They usually start off small where we can catch them. Sometimes you only have to monitor them. It doesn't necessarily mean they have to get them filled, but then at that point the dentist can let you know the steps that need to be taken to prevent them from becoming bigger, like flossing, using a fluoride mouthwash, brushing properly, and things like that. So once the cavity starts forming, your tooth can remineralize after that, but the chances are small if they've already gotten big. So we're trying to keep them at a very low, small size so that it doesn't get bigger and become a bigger issue. So it happens all the time where a patient knows they have a cavity, then they decide that they're not going to come in right away, they're going to hold off on it and come in 6 months later, and that cavity turns into a root canal. Now, if any of you have had a root canal, you know that the root canal is much more painful than a cavity is. And why that is because the cavity is getting so big that it's sitting on top of your nerve and it's exposing other layers of your teeth. I'm going to show you some photos and videos showing and explaining how a cavity forms and becomes bigger and then what kind of treatment it's going to end up needing. So this is a tooth that's starting off with a small cavity on the biting surface of the tooth, which is called the occlusal surface. And so is the next picture that's about to show. You can see that dark black spot on the tooth, that is the cavity. You can see the fissures and pits, that's where they usually start. The next picture shows cavity starting in the fissures of the teeth. Now these cavities are usually small enough where we just have to put a one surface tooth filling and then you're all done. This picture coming up shows a picture of the cavity starting on the right side of the tooth, forming into the other layers of the teeth, and this is the x-ray showing the cavity starting. This next one is of the cavity on the top of the tooth going into the top of the tooth with more layers being exposed to the decay. And then the next picture I have is a picture of something that's probably someone's had a cavity for years. This tooth probably needs to come out. Same thing with the next picture. The teeth in these pictures may need root canals. A regular cavity is not going to do it for these two teeth. These are some x-rays showing the cavities. You can see the cavities can start between the teeth, which is what's circled with the red circle. Those are pretty small, can be filled with just a regular filling. The next x-ray shows how, same thing, cavity can start in between the two teeth. You can see the dark shadow of the cavity of the tooth. This one shows the same thing on the upper right in between the two teeth. You can see the dark shadow. That cavity is pretty big and probably needs a root canal. Same thing with the picture that's coming up. That cavity is so close to the nerve where it's pointing that amalgam's pretty big. It's probably going to need a root canal and a crown to help save that tooth.
Take a look inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces, which require the removal of more healthy tooth structure to fix. It's also where most gum disease begins.
So going to the dentist is not as bad as many of you may think. Actually, a lot of dental offices now have a lot of up-to-date things like digital x-rays, new caries detectors, and even painless injections such as the wand. It's extremely thin needle that is controlled by a computer, so the speed of the injection actually makes it really comfortable where you don't feel it at all. Some offices even will put you to sleep when they do their dental work. Some of them will give you nitrous oxide to help you make you feel more relaxed. A lot of them have TVs in the operatory so you can watch something. You can even put some headphones in as they're working on you. The dentist is not there to hurt you. They're not there to scare you. They're just there to help you. They'll do anything to help make you comfortable there in the chair. And I'm sure if you have any questions, just feel free to ask and they will answer them for you. The health of your teeth and gums can affect your overall health. Gum disease is actually linked to heart disease, blood pressure, diabetes, and amongst other things. So it's really important to keep control of any kind of diseases in your mouth, which, like I said earlier, include gum disease and cavities. Just like I said, going to see a dentist twice a year is going to help you prevent oral cancer. Bigger cavities, that's going to cost you more money. It's going to save you time and money. So just why not go get it done and not worry about all these things. You might be scared now, but eventually it's just going to continue to get worse. So you might as well go now, help prevent yourself from all these bigger issues, while later it's going to be too late. You're going to lose all your teeth due to cavities and gum disease, and then, like I said, you're going to have to deal with bigger issues. You're going to end up having to be in dentures. So just why not go do it now? Twice a year, get your teeth clean. Catch your cavities while they're small. Will last you much longer, healthier lifestyle. Thank you for watching.